Back home, measles is back in New Zealand. Cases are starting to spread between regions. Health officials reported a new case in Wellington yesterday, bringing the total number of known cases to 11. The latest cluster surrounding Wellington College and Wellington Girls College. Low immunity, of course, that needs to be upped. Dr Matt Reid is with National Public Health Service, joins me now. Good morning.
Good morning, Ryan.
Matt, I mean, how serious is this? Do we need people to be staying at home? Is it not that bad? What's the situation?
I don't think we need people to be staying at home at this stage. But over the course of the last 2 months, we have had more measles cases since we had the outbreak in 2019. So it is a significant outbreak. Of course, we're doing all we can to contain it, but we are worried that there will be further spread.
Okay. What's so bad about measles? Does it kill you? Is anyone in hospital?
So luckily, I think as of today, we don't have anybody in hospital currently. But during that 2019 outbreak, we did have 2,000 or so people infected with measles, and around a third of them, like 700, were hospitalised. So that indicates how serious it is. Even for people that don't need to be hospitalised, it's a disease that makes you feel really rotten, and a week or two off work, and particularly for some people, particularly children, people who are immunocompromised, and pregnant women, that can be quite a severe illness. And we haven't had any deaths. We luckily didn't have any deaths in 2019, but there have been deaths overseas, even this year, in similar countries to New Zealand. So
right, okay,
that's a possibility.
What about the under ones? Because normally you wouldn't vaccinate a child under the age of 12 months, right? And some people are saying, oh, we might need to do that or start doing that. Why don't we do that now? Is there a risk from the vaccine to a under 12-month-year-old? That's the reason we don't do it now. And does the harm from measles outweigh any risk of that?
So it's not because the vaccine is harmful to the under ones. It's just that it doesn't confer long-lasting immunity like it does when we give it after the age of 12 months. So that we call that dose potentially given before 1, we call it dose 0. And before 1, there's still antibodies from that have transferred from mother to child. So the vaccine won't give durable immunity. We can give it though because it can bump up immunity. Just that because it won't last, you still will have to have that child will have to have a dose at 12 months and 15 months. And we do that for example, if a child is at the moment is traveling overseas to a place where there is high measles transmission, and if there's a more severe outbreak in New Zealand, we may move to giving that to children in New Zealand before the age of 12 months.
Right.
But we're not there yet.